thousands of people start researching GLP-1 medications like Wegovy every single month.
Right.
But so many run into an unexpected problem almost immediately.
Which is just understanding how doctors actually decide who qualifies, right?
Exactly. And, what happens biologically once you actually start taking it.
Yeah.
So for our episode today, we've pooled a stack of clinical trial data, AMA guidelines, and patient case studies to figure exactly that out.
And I mean, for you listening, we know navigating this space can be incredibly exhausting.
Oh, absolutely.
There is such a heavy emotional toll, the frustration from restrictive diets that just don't stick, the metabolic slowdown.
Yeah, and just a lot of valid skepticism about, so-called miracle solutions.
Right. Because the research clearly shows that the classic, eat less, move more advice, it fundamentally ignores how our biology actually works.
It really does.
Wait, so if I just cut calories and say lose 10 pounds, is my body actively trying to put that weight back on?
Yes. Yeah, it is.
Why does that happen?
Well, it's a biological process called metabolic adaptation.
Huh?
When you lose weight, your body basically senses a threat.
Wow.
So it lowers your overall energy expenditure and actively spikes your hunger hormones to fight the weight loss.
So it's basically acting like a smart thermostat.
Exactly.
If I try to freeze the house by dieting, the thermostat panics and cranks the furnace up.
Right. It spikes those hunger hormones to defend its favorite temperature.
That is a perfect way to visualize it. So this is where GLP-1 medications come into the picture.
Yeah, that biological pushback is exactly what GLP-1 medications are designed to bypass.
Oh, okay.
So the active compound in Wegovy, which is semaglutide, it basically mimics a naturally occurring hormone.
Right.
And it targets the hypothalamus, which is the brain's hunger center, while simultaneously slowing down gastric emptying.
Wait, so the food literally stays in your stomach longer?
It does. Yeah.
And your brain just stops hitting the panic button? But, I mean, does it actually work in practice? I've seen the hype, but what does the hard clinical data actually say?
Well, the data from the STEP clinical trial program is... it's what truly shifted the medical consensus.
Okay.
Participants actually lost an average of 15% of their body weight.
Wait, really? 15%?
Yeah, 15. It's a massive, unprecedented shift compared to traditional lifestyle interventions.
Oh, wow. I could
Wow.
totally see why demand is through the roof.
Right. But there's a huge misconception that anyone can just request this medication and get it.
Yeah, that's not true.
No. The clinical guidelines we pulled show doctors are looking for specific criteria, so like a BMI of 30 or higher,
Okay.
or BMI of 27 with a weight-related condition, so things like sleep apnea or high blood pressure.
So this medication doesn't just replace lifestyle changes.
Definitely not. And, the American Medical Association now officially classifies obesity as a chronic metabolic disease.
Right.
So the data tells us this isn't a short-term fix.
Uh-huh.
If a patient stops the medication, the weight frequently returns.
Wow. So it requires long-term management, much like treating, say, high blood pressure.
Exactly. And knowing it's chronic changes the entire timeline. It means this isn't just a 30-day fix.
Right. When you look at the patient data, there's a very specific biological sequence that unfolds over 18 months.
Yeah.
What exactly is happening in those early stages?
So during months 2 through 3, patients experience that initial appetite reduction and early weight loss.
Okay.
But the body is also, adjusting to that delayed gastric emptying we talked about.
Which is why early side effects like nausea or fatigue often pop up.
Right, exactly. So the body's adapting. Then we hit months 3 through 9.
And this is typically the sweet spot, right?
Yeah. You see steady weight loss and measurable improvements in metabolic markers like stabilized blood sugar.
Because the medication is efficiently overriding your body's thermostat.
Exactly. But then we hit month 9. And looking at the data up to month 18, progress seems to just stall.
Is that why so many people hit plateaus, even if the medication is still actively working?
Yeah. It's because the body is finding a new metabolic homeostasis.
Oh, okay.
You weigh less, so you inherently require fewer calories to exist.
Right.
The medication is still acting on the brain, but your new, smaller body has basically balanced out the energy deficit.
Wow. So that is the exact moment where behavioral and lifestyle factors become the primary drivers of any further progress?
Exactly.
But if the medication alone stops driving weight loss after 9 months, how are patients managing that new baseline?
Well, the research shows a pretty significant pivot in patient behavior right now.
Oh, really?
Yeah. Instead of viewing GLP-1s as just a standalone prescription, patients are moving toward integrated, physician-guided GLP-1 programs.
Okay, so what does that look like?
They basically combine the medication with continuous metabolic monitoring, nutritional coaching, and, behavioral support.
That makes sense. It treats the whole metabolic picture.
Yeah.
You're giving patients the framework to manage side effects early on and the lifestyle coaching to actually push through that 9-month plateau.
Precisely. Because knowledge is most valuable when you have the right framework to actually apply it.
Yeah, understanding the underlying biology really changes the entire approach to treatment.
It really does.
And while researching this topic, one medically supervised GLP-1 program kept appearing in patient discussions and case studies.
Yeah, it was a great example of this kind of integrated care. You can find the link in the description if you want to learn more about the program mentioned during this episode.
Definitely check that out. But as we wrap up, think about this.
Mm-hmm.
If we can chemically reset the body's weight thermostat today, what happens in 10 years?
Oh, that's a good question.
Right. We might soon be looking at a future where metabolic diseases aren't just managed after the fact, but prevented entirely by decoding a single genetic switch before the thermostat ever even gets set.